Admitting a patient to a ward. You can do this via your Medinet device, or you can do this via Power Charts. When you first want to Power Charts, you always have to make a relationship with the ward. To do this, you go via your list maintenance, you press New, or Location, Next. You then want to have a certain criteria for your ward, so you want to click on your discharge criteria and choose patients that have not been discharged. You go to your encounter type and you choose inpatients if your ward is only inpatients, but if you did have day case patients as well, you can also choose day case. You then go to your location, and using the small plus side, you want to find the hospital that you work in. For this one, I'm going to use for University Hospitals Coventry. You want to choose the building that you work in, so I'm going to choose the main buildings. I'm going to go to an adult ward, and then you want to find the ward that you are working on. So for the purpose of today's demo, I'm going to choose short stay surgery. You only ever have to do this once to set up your wards, and I want the whole of that ward, so I'm going to go in the box, and then I'm going to press finish. You can see it's here now. I'm going to add that to my list, and I'm going to OK it. I've now landed on the ward where I am currently working today. You can see up here from my patient list, it says the ward that I've just made a relationship with, surgical short stay, and I need to make a relationship with the patients that I'm looking after. You can do this individually by just clicking on that one patient if you wanted to. You can do this by the whole ward by clicking on here, and it's automatically selected every single patient on that ward for you. And if you didn't look after all of these patients and didn't want a relationship with these patients, you can deselect the patients that you don't need to have a relationship with. So my relationship with these patients would be a nurse role access, and I'm going to establish that. Now I can see all of the information that I need to see for these patients. So as I said, you can admit your patient on the Medinet device, and that is possibly what we will be doing 90% of the time, but you do have the options of going into your task box here, and as you know, that is just a little arrow in the box with the patient's name. You come to the side of it before you go into the next box, and then it'll come to a little arrow for you to press. When you press on this arrow, it will automatically give you the tasks that are required for this patient. And as you can see here, the tasks that are required for me to admit this patient would be the safety assessment, the admission history adult, and the vital signs adult, as well as the adult basic admission assessment. But the safety assessment is a task that will be tasked for you to redo every 7 days, as we currently reassess our patients every 7 days. So to be able to complete my assessment, I'm going to click on the things I need to complete today. Patients arrive in the ward, and I literally just press document, and when you press document, it will then take you into each of these things for you to be able to answer the questions for your patient. I'm not going to go through each of these pages because this is already our QRGs for this, and this was covered in your training, but you literally go through and answer all of the questions.